The best way to understand the deadly and dangerous landscape of post-Roe America is to understand that abortion is health care. Abortion is health care. Simple three-word sentence. A fact. But it is not widely understood, and that is by design, because the anti-abortion movement spent decades passing laws that separated abortion care from the rest of women's health care and peddling that well-crafted lie about what abortion actually is. Waves of anti-abortion laws targeted providers with extra red tape and bureaucracy that had no valid medical purpose, but was simply designed to make it harder, more expensive, and onerous for abortion clinics to keep their doors open. This succeeded in many ways in isolating abortion care from the rest of women's health care, which in turn made it easier for the anti-abortion movement to sell its foundational lie that abortion is not part of comprehensive women's reproductive health care, but rather that it is a totally separate thing that is mostly just used to terminate unwanted pregnancies. Now, let's be clear. Even if that were true, even if that were all abortion was ever used for, to terminate unwanted pregnancies, it would still be a necessary part of health care in a free society, because women should be able to decide when and whether to start a family. And the alternative, forced birth, is a human rights violation. But once the anti-abortion movement sold so much of the country on the idea that abortion could be and should be separated from the rest of reproductive health care or health care itself, it became very easy to demonize women for choosing abortion. And then, poof, Roe is struck down. The fundamental federal right of women to have dominion over their own bodies, gone. States, expectedly, were quick to enact bans, but post-Roe America is exposing the lie that brought us here. Day after bloody day. Story after heartbreaking story. Statistic after horrifying statistic. We are seeing in real time what being denied health care looks like, because abortion is health care. When you ban it, you're banning a procedure that's widely used in miscarriage management to preserve women's health, to save their lives, and to ensure their future fertility so that they can have children. You are forcing doctors to choose between administering health care and jail time. And the ripple effect of that are now being seen across every aspect of women's health care all over this country. At the Democratic National Convention this week, Amanda Zurawski and Caitlin Joshua took to the stage to share what have become all too common experiences. Women being denied care for a miscarriage. So here's the thing. The procedure for an elective abortion is the very same procedure that's often needed for miscarriage patients who had intended to have a baby. Because abortion is health care. And these women were denied health care, and they suffered mightily as a result. Amanda Zurawski went into sepsis and nearly died because she was refused care in Texas. Joshua's doctors in Louisiana not only refused to treat her miscarriage, they refused to document that she was even having one, for fear that they would be investigated. When you have physicians and healthcare workers so afraid of investigation and prosecution that they are setting aside their medical judgment and training and refusing care that they know their patients need, you're doing more than banning abortion. You're undermining the entire system of women's health care, and that is being borne out by a lot of alarming new trends. Starting with the brain drain of OBGYNs who are leaving states with abortion bans simply because they do not feel that they can provide adequate medical care under these arcane laws. And they are correct. And what happens when doctors don't want to practice in parts of the country that are openly hostile to their profession? It's what the March of Dimes calls maternal health care deserts. Entire counties without a single obstetric provider or any hospital or birth center offering obstetric care. These maternal health care deserts are on the rise, and that means more people, 7 million women, do not have local access to health care, which is why this next troubling statistic makes a lot of sense. New data released from the CDC found an increasing number of mothers receiving no prenatal care at all before giving birth. And as you would expect, with an increase in patients who cannot access health care, you'll see worse health care outcomes. A Tulane study found higher maternal mortality rates in states with more abortion restrictions. And in Texas, infant mortality rose by 13% the year after that state's 6-week abortion ban took effect. So the abortion bans are bringing us a drain on qualified doctors, higher maternal mortality rates, higher infant mortality rates, and a nonstop parade of traumatized women who feel compelled to share the horrific stories of what it means to be denied care in post-Roe America. Abortion is health care. It is one crucial part of a women's reproductive care, and you cannot take it away without dismantling the entire system. Joining me now is Michele Goodwin. She's a professor of constitutional law and global health policy at Georgetown Law, host of the podcast On the Issues with Michele Goodwin, author of the book Policing the Womb, Invisible Women and the Criminalization of Motherhood. Michele, welcome back to the show.
Thank you so much for having me on, and also for that very thoughtful, meticulous run-through of what has been taking place. It really is so horrific and chilling right now in the United States.
And it's been so effective. The anti-abortion movement has been so effective at separating these things that people have come to think of the idea that if I'm not planning to have an abortion, or I don't like the idea of an abortion, these things don't affect me. They affect other people. And what we're trying to do is illustrate, and you have done this so many times on our show, with statistics about maternal health care and infant mortality in the United States, staggeringly shocking numbers, that this is the consequence. If you deny this is health care, women's health care in general will suffer.
That's absolutely right, because so many of the clinics that performed abortion also provided contraception, prenatal care, postnatal care, ovarian cancer screenings, cervical cancer screenings, breast cancer screenings, treatments for STIs. When those clinics were forced to shutter before the Dobbs decision, that wiped away all of that type of access. For those that were able to stay open, now, after the Dobbs decision, they too have closed, such that we see the statistics that you mentioned. In states with these severe abortion bans, not only are there now heightened rates of maternal mortality, but we're also seeing infant mortality. And we're seeing things that really do strike at the heart of democracy. When people no longer can govern their bodies, it takes us right back to a terrible place in our history, which was American slavery. And one cannot separate the involuntary servitude that women are being forced through from the period of time 200 years ago, where African Americans no longer were able to govern their bodies because government and also private individuals were able to keep them shackled outside of their own personal autonomy and bodily liberty.
You were at the DNC, and a lot of people talking about it are talking about the celebratory environment and the joy and all that kind of stuff. What really stood out to me were those women who shared absolute horror stories of miscarriage and being denied care or requiring an abortion for reasons that regardless of where you stand on abortion, you would agree with. You called it life after Dobbs. Tell me about what that moment felt like to you, because I think it's going to be very influential to people, the millions of Americans who either watched it or are seeing the clips of that.
Well, what it reflects is an abandonment of morality. At its core level, it reflects a lack of humanity and human concern. Hearing those stories about women who wanted to be pregnant and were placed in life and death situations, near death situations, deathly situations, save for being able to escape their states and get the medical health care that they needed. It's a form of an insanity. I think that many people can agree that the period of American slavery was a period of insanity, grotesquely so. The period of Jim Crow was also that. It was just a reframing of American slavery. And what we see here, I've been sharing, is a new Jane Crow. If we had Jim Crow in the period after slavery, we have a Jane Crow now, where women have to flee states, where little girls are forced into elementary and middle school now as mothers, where the United States leads all industrial nations in maternal mortality, far beyond even countries that have been described as third world, where infant mortality is staggering. And we can connect all of this to states with these abortion bans. It is a matter of a horror, but it is also a matter of our democracy. When you take people's ability away to be able to care for themselves, you affect every aspect of their life. If you no longer have bodily autonomy, it affects every aspect of your life. course, with abortion and reproductive health care access, but so much more too. And that's what's been missing in terms of what people understand. In the 2022 midterm elections, there was predicted to be this red wave, a red tsunami. And I was telling people that was not going to happen because women were forced into a position where they needed to go out and vote and be very clear about what they understood as the risks to themselves, to their daughters, and to their nieces. And that is a matter of democracy.
I want to play for you something an Alabama state representative told me during our series of Velshi Across America back in 2022. Let's listen.
I could see why a doctor, anybody working in that office, or healthcare provider, or abortion provider, or Planned Parenthood that does everything else besides provide abortions, would now be afraid to talk to anybody that walks into their building.
That was literally in the immediate aftermath of Roe being overturned. That feeling of dread, which maybe sounded exaggerated in August of 2022, has only been validated and increased since then.
That's right. There has been the monitoring, the surveilling. If you look at Project 2025, which mentions abortion nearly 200 times, it really outlines what the next step happens to be. A national abortion ban, the surveillance of doctors, nurses, other medical providers, the surveillance of girls and women. And it is really predicting an authoritarian state vis-a-vis women and girls and their bodies, and with no relief. And what could we understand that as just points of cruelty that girls and women will experience, points of cruelty that people who love them will experience. Because let's remember the Texas abortion law also allows for individuals to go after and sue individuals who aid and abet people who terminate pregnancies. So who are those aiders and abettors? Yes, it can be your Uber or Lyft driver, but that could also be your mother. Now imagine a 10-year-old girl who's been raped, who has heard about this law, who now fears that she cannot speak to her mother, cannot speak to her father, cannot speak to her teacher or anyone else. That is not only a kind of shackling and a handcuffing, we should remember that that is a violation of our First Amendment rights as well. All of our constitutional rights are implicated in this, and people really need to understand that.